Hi, I'm Dr. Eleanor Toplinsky. I'm a board-certified medical oncologist specializing in breast cancer.
I'm Dr. Stephaie Graff. I am a board-certified medical oncology, also specializing in breast oncology.
So we are here at the San Antonio Breast Cancer Symposium, largest breast cancer conference in the world. And one of the things that, I've seen a lot of studies on is quality of life. How do we improve toxicity? And obviously one of the biggest things that our patients experience is hair loss.
Yes.
So when you're talking to someone who's about to start chemotherapy, what do you tell them about what they should expect with hair and what can they do to maybe reduce the risk of that?
Yeah, so we're really lucky at my center. We have one of the FDA certified scalp cooling devices. There's several available on the market, and both have really strong efficacy data. They're pretty cool. They're these sleek sort of silicone caps that fit over the hair. You wet your hair and they fit tight to the head, and then over the top of that there's sort of a tighter second cap that pulls it down so that it fits tight. And the idea basically is that if your scalp is cold, your hair follicles are cold, there's going to be less chemo delivered to those hair follicles, so less trauma to the hair follicles, less hair falls out. And so I talk to patients about doing that. In 2024, 2025, I have a great chance of getting insurance reimbursement, so it's affordable for my patients. And I know that a lot of my patients feel guilty, like that hair loss shouldn't be the most important thing, but it makes such a big difference in how you interact with the world, how you feel about yourself, about your relationships with your kids, with your partner, that I think it makes a huge difference. And so if I love being able to offer that to patients.
That's wonderful. One of the concerns that sometimes people have is it safe?
Yeah, and so it's been studied in trials and presented actually at this conference, was one of the first big major presentations, and showed that it was safe. It didn't increase the risk of cancer recurring in the scalp, which was historically one of the concerns that we had. Back in the old days, we used to use these like kind of crazy ice caps that you packed with dry ice, and there was a concern that people would get frostbite to their scalp. And with those newer devices that are literally embedded in the floor of a cancer center, things like Paxman or DigniCap, we don't see that same experience. So, my center has Paxman. The job I had before had DigniCap. I've had great experiences with both.
So, my advice for patients is, even if scalp cooling is not brought up to you, this is an important toxicity. It's important to ask, does your center offer scalp cooling? What does it entail? What are the chances that it's going to work on the chemotherapy regimen that I'm getting? These are really important ways to advocate for yourself.
And interestingly, there's actually even evidence that for patients that use scalp cooling and have hair loss, because unfortunately there are some patients who with scalp cooling still have significant hair loss. There's evidence that in those patients who lose their hair anyway, that they get faster hair regrowth. And again, it seems like a silly thing, but knowing with confidence that your hair will grow back, because there's at least one chemotherapeutic that has a small but serious risk of permanent hair loss. So using scalp cooling to have that reassurance that you're not going to have that consequence, I think is important.
Absolutely. Thank you so much.
Thanks for having me.